communication of audiences. It's like my leadership coaching mentor, John Maxwell, he talks about how everybody communicates, but few connect. People taking care of the patients. So anytime I would not be directly taking care of patients, I would just hold myself to a high standard of taking care of those that take care of the patient.
Hey everyone, we are having an interview today with Cindi Hammond. She's a member of Talk Toastmasters in Milford, and she's going to share with us a little bit of her life experience, a little bit of her background, and so forth. So welcome, Cindi.
Well, thank you, Jeff.
First of all, can you tell us what area you're from? You're from the Cincinnati area originally, and tell us about your family, some of your personal life.
Oh, okay. I grew up in Oakley before it was cool, and I currently live in the Pierce Township, very close to Anderson Township. I grew up, I have 3 sisters, and I married into a ready-made family, found my first and only husband at 37. So I have 2 bonus daughters and 4 bonus grandchildren. So we stay busy with fun, travel, outdoor nature type stuff, and just have a good time, trying to get together with them whenever I can. And my parents have gone to the great beyond back in 76 and 88. So I've been an orphan for quite a few years, but I have lots of other friends and families.
Okay, great. Oakley, and now you're on you've made...
Yeah,
well,
we're over on the...
I was going to say Oakley is not the west side, but I was going to say you made the transition from the west to the east, but you're from the center to the east.
Yes.
Awesome. But you're now over in the east side of town, kind of Anderson Township. Yes. Is that great?
Yes.
Okay.
Mm-hmm.
Professionally, you have a very interesting background. You're recently retired, I think, as a nurse practitioner for, was that in the neonatal ICU at Children's Hospital?
Neonatal intensive care.
Okay. Maybe you could tell us a little bit about that, and then certainly tell us about your new adventures that you're doing now that you're retired.
Okay, well, when I started in nursing school, I got kind of turned off with adult care, especially at the VA hospital. Nothing against veterans, I love them, I married one. But I thought, well, my career needs to be in pediatrics. So I started at Cincinnati Children's in the Wayback Machine, and I really love the newborn intensive care unit. So I've spent over 20 years there doing all the different roles there are to do. There's everything under the sun: management, consulting, heart-lung bypass, you name it, outreach education. Teaching, coaching, mentoring, orienting, onboarding, advanced practice, critical care nurse practitioners, and physician assistants. And I just kind of ran out of things to do at the Cincinnati Children's Hospital. So the way that the pension is set up, you can actually retire a little bit earlier before you actually turn 65. So I decided to do that. And I've been, in preparation for retirement, I have been working on coaching. So I have a real passion for coaching, and I myself had to coach myself out of burnout. I was very professionally burned out, and that's where you're exhausted, you're not nice to people, but I was pretty nice. And then you don't, think of your accomplishments as being, very great. So it was a kind of not a good spot to be in, but I found through my search of the literature, etc., that, applied positive psychology and coaching. So I've been working on that over the last 3 years. So I'm just finishing up my coaching with some leadership coaching with the John Maxwell team, and some spiritual, intuitive, dream building coaching with Mary Morrissey. My area of focus is to help people battle burnout or come back from burnout or work upstream so they don't get to the burnout stage. And one of the factors in burnout I've studied over the last 3 years, leadership has a big portion of how people enjoy their work, etc. So if the leader is very transformational and helpful and a good leader, there's like a 50% less amount of burnout in whatever profession, be it physicians, nurse practitioners, nurses, respiratory therapists, pharmacy, anybody in the healthcare field. So that's what I'm interested in, developing more of my leadership coaching. And also nurses are very intuitive and we're into emotion and the spiritual aspect of people and their illnesses. So that's why I'm working with Mary Morrissey Dream Building coaching at this time.
Great, great. Now, would you say, obviously you came from healthcare and burnout happens in every organization?
Yes, absolutely.
But in particular, I know I've talked to you in the past, healthcare is one where it hits you from all angles. So you mentioned maybe your direct supervisor certainly has an influence, but then also you're dealing with sick people, which has to weigh on you, or dying people in some cases.
Yes.
Um,
There's a lot of compassion, so empathy overload, where you really feel for the patients and families, and then there's also compassion overload from just trying to help people, and it's just very sad, the children and what circumstances they're born into, and birth defects, and working with families, and the social determinants of health, and it's all very burdensome.
and I believe at one point, I don't know how this fits in with some of the coaching that you're doing, you were looking at laughter yoga as a therapy.
Oh, yes. One of my initiatives, I love quality improvement work. So one of my initiatives when we at Cincinnati Children's, we're all about quality improvement because no child should ever be harmed, coming to the hospital. And the Children's Hospital partnered with the Institute for Healthcare Improvement up in Boston. And I did some work up there through school, etc. My doctorate degree. And so they have a white paper called Improving Joy in Work. So I just, I'm a very curious person, and I just love to, vacuum up information. So I started working on, joy and joyology, and I came across laughter, yoga, therapeutic laughter. So I'm also trained in that as well. And it's basically where you laugh for no reason, you take deep breaths, you relax, you have fun with people, not so much with the current COVID situation, but it's a very therapeutic, relaxing modality. So in the Joyology buffet, or self-care, is one of the other things I'm really focusing on in helping people build, battle burnout, not even get there, is good self-care. There's like a whole buffet of things that people can do. So it all depends on what resonates with you and what you're interested in doing, what feels good, what you can do with your circumstances and situations. So the joyology and the laughter yoga is so much fun. I try to laugh, every day because it's just very therapeutic. Your brain can get like a boost of all of the hormones that are associated with good feelings, the dopamine, oxytocin, serotonin, and endorphins. So just with, 10, 15 seconds of laughter, you feel better, already. And it's also contagious in a good way.
That would be great if we had a pandemic of laughter. That would be a good thing, definitely.
Yes, it would.
I
But
think
just
I'm going to
overall, just
I'm going to trademark
you're
that
going
term,
to
by the way.
trade. Yeah, okay, there you go. But also in my applied positive psychology studies, and what I coach in, Dr. Martin Seligman from the University of Pennsylvania, he has the theory of total well-being, very well evidence-based, lots of research, and he has a model called PERMA. So positive emotions is one of those that's very important, and laughter is part of that. Engagement and mindfulness, and that helps as well. Relationships, having those good, healthy relationships, meaning and purpose, and then also achievements and accomplishments. So with the positive emotions and the engagement and being mindful with the laughter yoga, that gets two of the, acronym of the PERMA. And then the H, of course, is healthy habits, just your sleep, hydrating, eating healthy, good mindset, good environment, just being, working on, looking at the silver lining in bad circumstances, practicing gratitude every day, just all the different things that you can do to lift up your, spirit if you're, down and out. And then, starting your day with good intentions, finishing your day with like gratitude, like the gratitude app, 3 good things or whatever. So it all kind of, fits together. So I'm a joyologist. So that means I study how do people, create joy in their lives or, for themselves and also at work.
Now, what's interesting to me, your background, you mentioned you have a PhD. Your PhD is not in psychology, correct? I mean, but you've morphed, or your career's kind of morphed into the psychology side of things, would you say?
Yes, well, my doctorate is a doctorate in nursing practice. So it's a DNP. The PhD folks, they generate new knowledge. That's their task. The DNP, the doctorate in nursing practice, we learn how to filter all the information and all the research out there and come up with the answer that is in the evidence, as we call it, for our problem or to improve our patient outcomes or whatever we're searching about.
So
And then
you would say academic versus practical. So you're more
yes,
on the practical side, yeah.
It's definitely practice. I've always done practice. I've done management in practice, consulting in practice. I love practice, taking care of the patients. They call it the front line, but I call it, patient side, because we're not there to get mowed down. It's so patient side and working with the families. That's what we're there for. So that's very interesting. And it's always been an interest of mine. I, started out being an adrenaline junkie and all the heart lung bypass and and then I've morphed into taking care of the people and the parents and working on that type of stuff.
And
But,
now focus. Sorry, I got a weird echo going on. So so focused on the patients, the families, but now transitioning to the healthcare workers themselves.
yes, the people taking care of the patients. So anytime I would not be directly taking care of patients, I would just hold myself to a high standard of taking care of those that take care of the patient. But I love this applied positive psychology because it's all the gurus that have done this all their lives, but they're putting out all this information for me to, vacuum up and, my evidence-based approach of, what works. And then when I, present, I do a lot of coaching by presentations. The last one I did on Zoom, it was like kind of crazy, but it's like, 76 people and they're all giving me, thumbs up and hands and whatever. But I always try to, get all the positive stuff, in there to help people just figure out, if they can just do, one thing, change one habit just to make themselves, happier each day.
Now you mentioned presentation. Tell us a little bit about that last presentation that you did over Zoom. You said there's 76 people. Who was the audience? What was the presentation about?
It was perinatal nurse managers, and I was one of those once upon a time. And perinatal just means everybody involved in labor, delivery, newborn care, healthy newborn care, critical newborn care in ICU. And my friends who I'd worked with before, they asked me back in like late fall if I could do a presentation on they needed their spirits reignited. And I go, oh, so I'm going to reignite the spirits. Okay, here we go. So I basically did a presentation using the PERMA model of Dr. Seligman's with the positive emotions, engagement, relationships, meaning and purpose, accomplishment, and healthy habits. And I enveloped it into a narrative of Florence Nightingale coming back for her 200th birthday in 2020, the year of the nurse and nurse midwife. And Dorothy Gale from Wizard of Oz, she'd already been, battled back from burnout. And so Florence was just asking Dorothy, what did you do to battle burnout and help your staff? So I just kind of go through the step-by-step type things.
Nice. Well received from what I understand.
Yeah, they loved it. Yes, absolutely. Yes, they and I got all kinds of kudos, and it's like this is the first thing that I've seen that I can actually use with my own staff. It's very structured, and it's very good evidence, and there's lots of books and resources on every single one of the elements in the PERMA model.
I mean, you mentioned empathy before. It's maybe the first time that people have felt these frontline workers have felt any kind of empathy or understanding, perhaps. I don't know. Would you
Are you
say
talking
that's
about the general public's
no? No, I'm saying
impression of feeling?
your audience, people that are working on the front line that aren't getting. It's not a matter of getting recognition or, but people understanding what they're going through and just the difficulty of doing their job.
Oh, yeah, I think it's been good to get the press recognition of how hard our work is. However, this is what we sign up for. It's like weekends, holidays, night shift, day shift, evening shift, and death and dying. All the aspects of life. But that's what we sign up for. So it's what we are oftentimes called to do.
Now, we mentioned at the beginning that you're a member of Milford Talk Toastmasters. Tell us a little bit about Toastmasters and how you got involved. I know you were involved many years ago and then have come back, and how that's helped with your presentations.
I was in Toastmasters in the late 80s in Hyde Park Bethlehem Church group. And then our president got married and, everybody kind of went away. But I was already at the competent level. So it's like, this is okay, fine by me. However, with my very demanding work schedule as a nurse practitioner, I wasn't able to do a lot of coaching, one-on-one with people because I would work and then I would recover and family and, all the things that take up our time. So I was coaching through presentations, and I was asked to come out to a presentation out in Arizona, and it was about putting on your own oxygen mask first. Same thing, self-care and that type of stuff. And I sped through that presentation, and it's like, I'm sure they were just like, OMG, what is she saying? And it's like, oh my goodness, I was just like, everybody loved it, of course, and they're like, oh, we need your slides, and and I had some interaction and that kind of stuff, but I was displeased with my presentation. I have been doing some fun work with gamification, which is making not very exciting material, safety training or whatever, more fun through games. And part of the training was to do a motivational profile. So as you're designing games, you can meet with the mechanics of the game with the motivational profiles of the persona or the people that you're designing for. So one of my very highest motivations is curiosity. So it was like, aha, how self-knowledge is so powerful. But curiosity is what makes me want to, learn, just backing up all the information. However, I expect my listeners to be that way. And they don't need to know everything about everything. So that's why I thought, I need to get back to Toastmasters to slow down, to condense, to get some real-time feedback on, presentations and presentation style and how I could, get, tips to improve things. And when I did the dry run of the presentation we were just talking about, reigniting your spirit, I got a lot of good feedback about, altering my voice when I was talking about the Wizard of Oz and Dorothy and Florence Nightingale, and people commented about that. They loved it. And I was able to do a little bit more. I didn't have much time, but I was able to do a little bit more interactive, experiential learning and that type of stuff, which was good, feedback. So the Toastmasters group is very good. They're very kind with feedback. I look at feedback as being a gift. It's like, and you spend time on doing things, and it's like I'm kind of over that you think my baby has problems. It's like, hey, what can make it better, and that type of stuff. So I enjoy the feedback and also the camaraderie and also the learning from different people, such as yourself with technology. And then we have a person that's in the law profession. We have a person that's a seamstress. We have a person that's retired. A person in HR, which is an absolute hoot because I'm also cross-trained in education and human resources with a master's degree. And just the stories and the just one example was she did a presentation on how to not get hired. And she proceeded to go through all of the things that are wrong on the resume and how people present and how people show up. And I mean, it was just an absolute hoot. So I'm job hunting. So I'm like, okay, I'll be sure to, but nursing gives you a very good code of ethics and a very good, presence, just focusing on presence, that I don't make a lot of those same mistakes that, she was talking about. But it's just very interesting and just different, just like cheerful people that, there. And it's, a good cause of, promoting your speaking skills as well as leadership, and then the camaraderie.
Great, great. Fantastic work that you're doing, and using your communication skills and leadership skills. You mentioned the educational programs that Toastmaster has that they would call pathways. You're doing, which pathway are you doing?
Persuasion of audiences. It's like my leadership coaching mentor, John Maxwell, he talks about how everybody communicates, but few connect.
Well, wish you luck with your, you're gonna need luck. I should say best wishes with your adventures going forward on
Yes.
on burnout and so forth.